Hello, I'm Joan Comrie. Today we're going to talk about the gag reflex. With the beginning of baby-led weaning, parents are constantly asking me, is it normal to gag? What is gagging versus choking? A lot of these type of questions are all over the internet. And what we need to understand is, what is the gag reflex? Let's talk about that. So there's a lot of reflexes that you have as an infant, and some of them integrate, and the one that stays with you through your whole life is the gag reflex. And what that is your body's ability to stop you from swallowing something that is not safe. Maybe it's too big, maybe your body's afraid you're going to aspirate on it, maybe it's going to obstruct your airway. So if it gets to the far back of your tongue where your swallow is going to be initiated, your body says, we're not going to do that. We've got to stop. This is not safe. And the gag makes you kind of, and everything comes forward. A good example of that for us adults is if you're eating a lifesaver and you're kind of not really paying that much attention to what's going on, and all of a sudden you go, and you just realize you almost tried to swallow it, and your body said, no way, this is too big, and shoots it forward. The gag reflex is a protective response that we have in our body to help us stay safe. And if a child is using that protective response, which you want them to have if they're trying to swallow something unsafe, that certainly is a reflex that we want to have. We don't want to have, and I've seen in my practice kids who could swallow entire chicken nuggets whole. I mean, they take one chew and it goes down. They have desensitized their gag reflex to the point that it's not really very safe for them because their body is not saying, stop, this is too big. But let's just assume that we have a child and you're doing baby-led weaning and they're doing a lot of gagging. And on one hand, that's good because your body's saying, this is too big, you can't swallow it, you're gonna obstruct. On the other hand, if you have a lot of gagging during feeding, your child is going to start pairing eating with that kind of scary body stopping response of your gag saying, don't swallow me. And when you pair those two together, you will find at some point, depending on how sensitive, I mean, some babies are super sensitive, it only takes 1 or 2 gags and maybe even a vomit, and boom, they're done eating. Some kids can do a lot of it and it takes a really long time and then they stop eating. But eventually they're going to be pairing that scary response of gagging to feeding, and they're going to stop eating. So it's really, really important. If you're doing baby-led weaning, you see a lot of gagging. You need to look at, does your child have the skill to handle that food that you're giving them? And if not, those skills sometimes need to be trained. And that's what a person like me, a speech pathologist who has specialized in feeding and swallowing disorders for over 35 years, those are the kids that I see and that I can help parents with. So find someone in your community that can help you. Kids don't just outgrow it, it changes. So they may be having these issues when they're little, and as they're a 14-year-old child, they're not going to eat the foods that you want them to eat, and you're constantly short order cooking, and that is not fun for them or for you. So get some help. I'm also available with parent consults. We can do that through Zoom. You can contact me at feeding.com and set something up, or even ask me questions. You can leave questions at the end of this YouTube video if you'd like. Please like this, please subscribe it. I spend a lot of time putting these together, and I'm hoping and get a lot of feedback that it's really helpful, but I'd really like to be able to reach more people, and I can do that if I get a bigger view. So please feel free to do that. I would greatly appreciate it. And good luck, and continue listening. Thanks for your time.